You're listening to Be Health Connected, a podcast by the Gateway Business Health Coalition. Your host for today's episode is Kaylee Delishmitt, BHC Manager of Wellbeing Strategy and Member Services.
Hello, I'm Kaylee Delishmitt, Manager of Wellbeing Strategy and Member Services, and welcome back to the Be Health Connected podcast, brought to you for the very first time by the Gateway Business Health Coalition. Today, we are joined by Dr. Bob Chestnut, who serves as the Chief Medical Executive Director at Cummins Inc. Dr. Chestnut leads the clinical operations strategy for over 70,000 employees in more than 190 countries and oversees the delivery of occupational health, primary care, and telemedicine. Through his work, Dr. Chestnut drives improved healthcare experiences for thousands of Cummins employees by prioritizing patient-centered and advanced primary care in Cummins Worksite clinics. Dr. Chestnut, thank you so much for joining us today.
Yeah, thank you, Kaylee. Happy to be here. Thank you so much for the invite.
So could we start by having you tell our audience a little bit about your professional journey and what drew you to the world of employee wellness?
Absolutely. So I am a family physician and an occupational and environmental medicine physician by training and background. But the journey began before that. When I was an undergrad, I was a wellness coach for an employer-based well-being program. The program I was part of was a 3-month incentivized uh, lifestyle behavior modification program where people would come and they would have biometrics done. They'd find out their percent body fat. They'd do some flexibility and strength testing, and then I'd work with them for 3 months and meet with them on a weekly basis on whatever they were focused on. And many people, many middle-aged professionals, right, are focused on weight loss, and so worked with a lot of people on that. And then at the end of the 3 months, we do those tests again, and see how people came out. And that was kind of my first foray into employer-based health and health and well-being programs. And I saw firsthand what can happen when a employer aligns their interests with the interests of an employee, and they find a way to incentivize it. And that type of program isn't uncommon. Sometimes it works much better than in other places. A lot of it depends on the wellness coach and how well they're able to help people through each of those steps. But that really gave me a taste for employer-based health and the systems that can exist when an employer is really involved with the health of their employees. And so that put me kind of on a track where when I got into medicine, I started to look around and say, where can I work, where I can really focus on systems of health and or get to population health, where it can have a broad impact, and where I can focus on a lot of it on lifestyle behaviors and how we can really help motivate people to make the small changes and habits that we need to develop in order to lengthen our lives and improve the quality of our lives. And so initially started going into occupational health, but felt it was a little bit limited, and so I expanded that to do family practice as well, to kind of build that broad foundation. And as I was going through all that, things like integrative medicine and lifestyle medicine really began to take root and to spread. And I would say that those are both specialties in medicine where I'm not a specialist, but definitely an enthusiast for those. And both those are things that we've put into our programming. So that's a bit about me. And I'll say that wellness coach part of me continues to be very much part of much of the programming that we do at Cummins for our employees.
I think there's so much to unpack in just your intro alone. I especially appreciated, you're wanting to make a broader impact, but also your point about aligning employee goals with employer goals and vice versa, because it's when that synergy happens that, true change can take place. You mentioned lifestyle medicine and advanced primary care. So can you dive into a little bit deeper how lifestyle medicine and advanced primary care is integrated into the Cummins model?
Yeah, yeah. So, for Cummins, we have a number of on-site clinics at our sites with a higher volume of Cummins employees. So, we have 45 on-site clinics throughout the world, and we have 9 in the United States. And so in the United States, the primary function of those clinics is definitely occupational health. But where we have sufficient volume, we've also expanded that to include primary care with fully integrated lifestyle medicine. So advanced primary care for employers is a little bit different than what you've experienced potentially out in the wild with primary care. Unfortunately, primary care in general in the U.S. has been underfunded for decades, and so it's been low resources, and it hasn't been the specialty that has really drawn in a lot of people, and a lot of that is because of the sheer volume of work that is done. It can be a tough environment that has a lot of potential for physician burnout. And so it's been a difficult place to practice medicine, but we know that it is also the foundation of any healthcare system that throughout the world that is making a difference in lengthening lives and improving the quality of lives. One consistent thing we see is that systems that are successful heavily invest in primary care. So advanced primary care is a concept that reprioritizes primary care, and it acknowledges that high quality comprehensive primary care likely needs to be funded better than it has been in the past, right? We need to step away from that chronic underfunding that we've had, and we need to support it better. And so a place where we've been pretty successful with advanced primary care is in the employer setting. And so with employers, you tend to have kind of a carve out where you can put in advanced primary care. You can be okay with it potentially even costing upfront a little bit more than it does elsewhere, because you are potentially paying a little extra for adequate staff for your clinics and for the right talent as far as your providers go and your physicians go. But you also expect an improved output. You expect that with that, you will start to reap the benefits of having access to that higher quality clinic. And then to speak to your second piece, lifestyle medicine, lifestyle medicine really talks to the behaviors that we can adopt and we can develop to really promote our health. And many of those behaviors are not sufficiently taught and are not sufficiently put out there. And we have many systems that work against a healthy lifestyle in specifically in the United States, and that lead us more toward a sedentary lifestyle and toward a high caloric diet that has relatively few nutrients. And so we have systems that kind of push us in the other way. And so lifestyle medicine is a really systematic approach, an evidence-informed approach that really pushes us back toward what are those behaviors that can really make a difference. So when someone goes to an advanced primary care clinic where lifestyle medicine is integrated, they'll be appropriately diagnosed, say like with high blood pressure, but they will, in addition to whatever treatment is being offered or follow-up for that high blood pressure, they'll also have other options to them, such as wellness coaching and maybe a teaching kitchen and things like that, or exercise coaching that are alternate ways that someone can also manage their blood pressure that may or may not include, typical medicine that you would use.
It sounds like there's a lot of collaboration and you're offering a very comprehensive approach to employee care. And it makes me think of a couple of organizations being the Primary Care Collaborative and the American College of Lifestyle Medicine. It's my understanding that you have some partnerships with both those groups, and there's even like a subset of chief medical executives that you discuss the role of advanced primary care and worksite health with. Could you elaborate on your partnerships with those two organizations and why they are so valuable to you in developing your population health strategy for Cummins employees?
Yeah, yeah, thank you. So the Primary Care Collaborative, that is a a national group, multi-stakeholder group that really focuses on the health and well-being of Americans by strengthening primary care. So, lifestyle medicine, primary care, whole person health, kind of those things that had mentioned before. I'm on the board of directors for the Primary Care Collaborative. It is, typically, other members there are leaders from, the American Academy of Family Physicians, American Academy of Pediatrics, large organizations like that generally represent physician groups and provider groups. The A lot of the focus is to bring a wide variety of stakeholders together who are invested in primary care and really look at innovative ways that we can change delivery models, including how we pay for primary care, how can we get toward more value-based payment, and things like that. And so we've had some pretty significant success with introducing some new models for value-based payment with that group. And then we're talking more with that group. We're focusing more on payers, including employers like Cummins and others who pay directly for healthcare benefits. And part of that is because many people in this space have had to be quite innovative in offering their own clinics, offering their own options for high quality primary care. And so right now we're at a place of some increased partnership with Primary Care Collaborative and payers and corporations to see, what solutions can we find that we could that have worked well for corporations that we can apply in scale to the general public. And we have a conference in I want to say it's in June, where we're looking at bringing a lot of thought leaders together with that to really look at what solutions can we take from the private sector and from other settings and apply it to the general public. And then the other, like you had mentioned, ACLM, the American College of Lifestyle Medicine. And with that group, I work with a employer subcommittee within that group, and really looking at how we can take lifestyle modifications and that that lifestyle medicine approach to advanced primary care and population health, and how do we package that best for employers, and how do we empower employers to be able to integrate that into their services and really make sure that those lifestyle behaviors are being adequately prioritized in health and wellness programs.
In your response, you said that some employers are getting creative with the ways that they're delivering primary care to their employees. And we're seeing that among our own members at BHC, actually, many of which offer near site or on site clinics for their members with the goals of increasing preventative screenings and care, as well as access. So, can we dive a little bit more into the Cummins experience with on site clinics?
Yeah, absolutely. And so, and we'll speak specifically to the U.S. So in the U.S., we have 9 on-site clinics, and we use a third-party vendor for that, Premise Health. We've been in partnership with Premise Health for quite some time. And I'll speak specifically to our main clinic. It's a large patient-centered medical home, advanced primary care practice in Columbus, Indiana. It is a large facility right across the street from our main Cummins headquarters. We have about 70 healthcare personnel there who are engaged with patient care, both for employees as well as family members that live in the surrounding area. And so with that, we have occupational health, full primary care, and then we have physical therapy, integrated mental health. We do have our wellness coaches and our teaching kitchen, chiropractor, as well as acupuncture, all there. It's quite a bit as far as those services go. And so with that, we have a number of additional services and programs, specifically with our teaching kitchen. People can self-refer to the teaching kitchen, or they can be referred there. And we have group visits as well as individual visits that people can participate in. What we've seen in our clinics is, we really get out of them what we put in and what we prioritize. And so for the past few years, we've really focused on our chronic condition management, specifically our hypertension, diabetes, mental health, obesity, and being overweight. And we've really increased our programming for that and increased our engagement for that. And so, for example, for our individuals with hypertension, we have about just under 1,000 individuals who would be classified to have hypertension, who are seen by our doctors there. And so that is a group that we follow, and we check in on how that group is doing as a whole, and then we check in on to ensure that our doctors are adequately following up with those individuals. With that, with our patients who have diabetes as well as hypertension, that increased focus, we're seeing pretty tremendous results. And so for those individuals, just to talk a little bit about the integration of lifestyle medicine, someone with one of those conditions will be referred to our wellness coaches as well. They're not obligated to see them, but it's more of an opt-out situation. If someone chooses not to see them, they definitely don't need to. But otherwise, they'll be referred to see one of our wellness coaches. And then with these conditions, we'll also have a condition management nurse that follows along with each individual and just ensures that they're getting all the preventive measures that they need. So with that, I'm glad to say that we've seen some pretty tremendous results. We've seen hypertension control and diabetes control be 95th percentile compared to national norms or HEDIS measures. And we've just had a high level of engagement, and we've seen more and more people coming to our main clinic there to seek their care.
It sounds like you're seeing a lot of success in that area. I don't want to put you on the spot, but can you share a little bit about how you're communicating about the clinic and driving utilization of the clinic? Because not all employers, even with the best intentions, when they stand up this on-site or near-site clinic, can get everyone to go and make use of it. So has Cummins done anything innovative to drive people to the clinics that they offer?
Yeah, and I'll throw out there, time is one of them, right? And it is that at this point that main clinic has been in place for 8 years, and so I will acknowledge that there may just be a time component in there that people have become more and more familiar with it over time. Um, a I can say that we've met with the physicians themselves and have talked to them about generating a followership. Right, we have clear data showing that people who are being seen there are getting far better results than elsewhere. And so really, encouraging the physicians to, whenever they get a chance to recruit someone new, to their patient panel that they're doing that. Another thing we've done is that we've gone out to our plants on site. So we've hosted table events where we'll go out and we'll actually meet with people, and we'll find opportunities to promote it one-on-one on site where the people are working, and that has been relatively successful as well. Another one is that we've identified some champions, and so part of our employee base here in Columbus is unionized, and we found that our union reps and our union leaders who've been to the Live Well Center itself and benefited from it have been great champions for it, and have shared that. And so we've held, we've met with leaders to share what's available, and then we've also hosted events, open house, where we've specifically invited leaders to attend as well. And so I would say it's been a number of different approaches, but what tends to work well is meeting with people one-on-one, trying to get them in the door to at least see it. And so when someone comes in, I should add, yeah, that is something we do very deliberately. When someone comes in for an occupational health related thing, that we take the time to give them a tour of the building. It's while you're here, let us walk you around and show you what's available to you. And that has been very successful as well.
I love that. It's a lot of relationship building, building the champion network, building a level of comfortability and familiarity with the clinic. So thanks for sharing that insight. Mental and behavioral health has become a growing priority for employers in general, but especially BHC employer members. And many are looking for ways to increase access to mental health resources. Some have taken it one step further and integrated mental health into their worksite clinics.
Mhm.
Has Cummins integrated mental health or behavioral health into its health strategy? And how do you see that meeting the needs of your employees?
Yeah, so we have, and so I'd say, our overarching approach has been a anti-stigma campaign around mental health called "It's Okay," and with that, a few years ago we expanded our EAP offerings quite a bit, and so our EAP offering is that someone can have up to 16 visits per year for EAP, regardless of the condition, and it renews every year. And so we have the door is pretty wide for any mental health needs. Someone is able to use that on an annual basis to proceed with that, and that is telehealth, in person. It is across the entire United States. Then at our locations where we have higher volume, we'll have more resources. So specifically at the Live Well Center in Columbus, we have several therapists, and then we even have a part-time psychiatric nurse practitioner. And a year or two ago, we had found that it was taking quite a while for our employees to get in to see a psychiatrist. For some, it was up to even 8 months. And so with that, we started to look for solutions. And I will say we lucked out, and I had someone reach out to me who was or is a psychiatric nurse practitioner who wanted to move to the Columbus area, and was wondering if that fell in line with what we're trying to do at the Live Well Center, and it absolutely is. And so she's been with us now for, I believe, about a year and a half, and our wait time to get someone in has dropped from up to 8 months down to about 2 to 3 weeks.
That's awesome. And we've seen that with our employer members as well. Those that have integrated mental health, they say that the mental health providers are booked weeks in advance. So, like our school districts have a shared clinic in a few different locations, and they say that the moment that mental health was integrated, it was being used by all the people who were utilizing the clinic. So it's great to hear how employers are moving towards integrating mental and behavioral health resources into primary care and other more traditional or more innovative routes of delivering care to employees. Before we move off the mental health focus, I do want to throw in a shameless plug of our upcoming 2025 community forum that's actually going to be focused on workplace mental health, the challenges, opportunities, and solutions for employers. It'll be on April 17th at Washington University. It'll be our first full day agenda because we just could not see a way to, cut it down to a half day agenda. So we're really excited and wanted to throw in a reminder. Dr. Chestnut, obviously, we'd love for you to join us if you're available, but we all know how busy you are in your current role.
Sounds like a great event, and glad to hear that such an emphasis is being put on mental health.
So I think that's the end of our questions. Do you have any parting words for our audience or for BHC employer members or words of advice that are trying to really up the ante and improve their delivery of care to their employees?
Yeah, and thank you. That this interview has been great. Appreciate all your thoughtful questions, and so the thing I would say is that the employer space can be can be quite challenging sometimes, and there are a lot of point solutions out there that could be seen as fluff or may be fluff, right? They may not bring about the changes that you want, and so employer to employer, my advice is to really challenge your vendors to really look at the outcomes that you're looking for, and really expect your vendors to take on the risk. If they are not delivering on those outcomes, then they shouldn't be in this space. They should either meet those outcomes and offer you a product that meets those outcomes, or you should probably seek another vendor who's willing to take on that risk. And so I would just encourage you to really seek after really robust systems. You don't want high level primary care. You want comprehensive primary care, and really challenge your vendors to not just meet with people for diabetes appointments, but actually shift their hemoglobin A1C and actually their lab values and those markers, really shift those in the direction that shows that their health is improving and their risk is dropping. And so my encouragement is to keep going and to really challenge your vendors to deliver on what they're saying they're delivering, and to take on the risks themselves if they're not meeting those outcomes.
I love that. So if we're going to hold employees accountable for their health and their well-being, we should hold our partners that are helping deliver healthcare to our employees accountable for the risk and for the outcomes that we're seeing in our employees.
Absolutely.
Well, thank you again so much for taking the time to sit down with us today and discuss such an important topic. We appreciate the opportunity to highlight your success at Cummins, but even more so, we appreciate your dedication to improving the access and quality of care delivered to your employees. And thanks for listening to Be Health Connected, empowering healthy workforces one conversation at a time.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the Gateway Business Health Coalition, please visit www.gatewaybhc.org.